In theater, breaking a leg can be a superstition. For a ballet dancer, though, it can be an unfortunate reality.
Dancers are prone to injury because they are hypermobile as well as hyperflexible. They also have to take their bodies and joints through extreme range of motion in order to achieve a lot of the movements that they need to do on stage. Dancers often go on to what is called on point, and this is where they raise up onto their tippy toes. They need to be able to have core stability and strength, as well as strength within their legs and their upper body in order to maintain the appropriate posture to look graceful when they're doing this. In addition to the hips and the knees and the ankles, the foot is often stressed. These are the intrinsic muscles as well as the small bones in the foot. These bones and these muscles have to be able to take a lot of weight, up to 2 to 3 times the body weight when they're landing and going up into different positions. Dance was a big part of my life growing up, and it was really one of my passions and something I truly loved. I started dance at the age of 3, and I danced in a company doing ballet, tap, jazz, and competing. Unfortunately, I did sustain some injuries that resulted in ankle instability, and I was unable to get onto point the way I needed to in order to be a successful dancer. I often see a variety of different injuries in the ballet dancer. We often see stress reactions or stress fractures in metatarsals, which are small bones in the foot, as well as within the ankle, such as the fibula. It can also lead to prolonged tendinitis, which is inflammation of the various tendons of the foot and ankle, because there is a lot of stress to keep those ankles up on point. In addition, dancers have a high risk of what we call ankle impingement, particularly posterior ankle impingement. And you can imagine when a dancer's foot is plantar flexed, which is hyperflexed down, they're constantly pinching the back of their ankle joint, which can cause a lot of stress to the soft tissue and the bony structures in the back of the ankle. We often see an injury called osteogonum, which is where there is an excess piece of bone in the back of the ankle. This often requires surgical intervention. The type of surgery that we can perform now is actually a very novel approach with a needle camera so that we can debride the scar tissue and remove the excess bone. While as athletes, we tend to be able to play through pain and dance through pain, and dancers are some of the toughest athletes I treat. Dancers should listen to their body, and if they're having any pain, they should see an orthopedic surgeon to be evaluated. That way, they can continue to look majestic and mystify us with their graceful moves. Should I try now?